Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.
This is St. Louis on the Air from St. Louis Public Radio. I'm Elaine Cha.
If you shop local, that money stays in the community longer. It's about buying local.
They're able to see themselves as they come in. Things like our tone skin Band-Aids. So basically, they're Band-Aids that match the skin color of the people who actually are patients of ours.
August is Black Business Month, a month when folks are encouraged to buy Black as one means to address the economic impacts of social and racial injustices in the United States. One local organization, Delmar Main Street, is hosting a Black Business Expo on the 26th to make it easier for St. Louisans to find local Black-owned businesses to support. And we have Lisa Potts, Vice President of Delmar Main Street, here with us to share why everyone should be willing and ready to spend their money at Black-owned shops, offering all kinds of goods and services. Lisa, welcome back to St. Louis on the Air.
Good morning. Good to see you again.
We also have Marcus Howard, founder of GreaterHealth Pharmacy and Wellness, with us today. His pharmacy is one of the many businesses that will be part of the Delmar Main Street Black Business Expo on August 26th. Marcus, welcome to the show.
Hey, how you doing?
Great.
Glad to be here.
Thank you both for being here today. Lisa, let's start with you. Now, the Delmar Divide has come to be known locally and even outside St. Louis. Mm-hmm. But Delmar Main Street is not so well known or recognized. What is Delmar Main Street?
Yes, well, we're a new nonprofit collaborative made up of businesses, stakeholders, nonprofits, and residents that are along the Delmar corridor from Taylor to the city limits. And we are part of a national organization called America Main Street, and we exist solely to support existing small businesses and welcome new businesses to the corridor.
Mm-hmm. Now, Delmar Main Street is hosting this Black Business Expo this month. What is it that folks can expect when they attend?
So this is our second event, and so we're excited. Last year we had an event with over 70 vendors, and it was amazing just to have all those vendors in one location. It's an outside expo. We're going to be at the corner of Delmar and Hamilton, so it'll be super visual. We have music and fun, and it's just an opportunity to bring businesses together from throughout the community to focus on Black Business Month. Mm-hmm. Some of these businesses are still suffering behind the pandemic, and so it's one way that we can say thank you for what they do and trying to support their livelihood, and then to fellowship, and then to also educate them on different financial opportunities.
Mm-hmm. Now, you were on the show, Lisa, just a couple months ago, almost exactly 2 months, I think,
okay.
to talk about your efforts with We Collab. Time flies, right?
Yeah.
And encouraging folks to work with their aldermen and their alder people to make sure that any development or construction in your community, any given community, involves buy-in from the neighborhood's residents, so it is not, imposed.
Correct.
Right? And your neighborhood is the West End,
where Marcus is.
and it's predominantly Black and borders Delmar and that Delmar Divide we were talking about. Lisa, what does supporting Black business or that is buying Black, what does it mean for a neighborhood like the West End or other Black communities in this region?
Because it's about buying local. So what's different about shopping on Delmar is that these are people that I know. Like, these are people that I can genuinely say, like, these are my friends. Mm-hmm. This is my family. And these are people that are, like, this is their job. So, like, I go to a, 9 to 5 every day. This is their job. Mm-hmm. And so we as community residents have to support them because that supports the local economy. Yeah. If you shop local, that money stays in the community longer versus if you go, to Chesterfield or somewhere and shop. So that's why it's important to me and to the community.
Now, give us a bit of a run through of some of the businesses that are participating, Marcus is going to tell us a little bit about GreaterHealth
Absolutely.
shortly. But what kinds of goods or services do the different business owners coming out provide?
Absolutely. So I'm looking forward to we have some food trucks and then some food businesses, some great customized products. So we have a new truck that I'm looking forward to. We have Bougie Bites, and they're a vegan option, so people are excited about that. We have Shaver Smokehouse. I've never met them, so I'm looking forward to trying that. We have clothing, candles. I mean, you name it. A lady called me today and said, I make custom sheets, and kids are going to college. Can I bring those? And I was like, wow, I never thought about that. I was like, absolutely. Bring what you have.
Okay.
We have people who make their frozen drinks and fruits and things of that nature. So lots of fun activities, for everybody to participate, and lots of really great things to buy.
Yeah. Now, it is called the Black Business Expo. That doesn't mean it is limited to Black shoppers. What does supporting Black businesses do for the city and the region overall, whether you're Black or not?
Absolutely, because at the end of the day, it's about green. We measure the economic impact of the day. So we need everybody to come out and to support, these businesses, because these businesses make up our community and they make up our rich culture. It's not just about Black or white. This just happens to be National Black Business Month. So we want to honor that and we want to support those businesses, but we want everybody to come out because money is green.
And green makes things grow, right? Yeah. Now, and on that point, Marcus, GreaterHealth Pharmacy and Wellness opened to the public in February this year, so Black History Month. I don't know whether that was on purpose or it just sort of happened.
Absolutely. Last day of Black History Month. Yeah.
And you've consistently described your pharmacy as radically inclusive and culturally responsible.
Yep.
Okay, radically inclusive. What does that mean in daily practice?
No, great question. And so we are the first radically inclusive, culturally responsive pharmacy in the U.S. And so specifically, like you all are talking about, we are Black owned, but we are open to all patients, right? So radically inclusive, culturally responsive. It means that no matter the race, no matter the ethnicity, the gender, the orientation, the religion, the country of origin, the socioeconomic status, anybody should be able to come into our pharmacy. They should feel welcome, they should feel valued, and their health needs should be met. And that's the type of experience that we want all people in the city of St. Louis, specifically those in Delmar, to experience. And historically, that has not happened. And so we're very excited to be able to train our staff to ensure that our staff knows our patients, knows the specific demographic of our patient, the specific characteristics and variables and health history of our patients, and to be able to provide, no matter the difference of that patient, they should be able to get the support they need. And so radically inclusive and then culture responsive, just making sure that there's currently a culture gap in healthcare where healthcare providers have to understand the culture of the people that they serve. Anywhere around the world, that's very important. Unfortunately, here in the United States, we don't necessarily see that as much. And so we're very intentional in being able to provide a culturally responsive experience, because that culturally responsive experience allows us to connect to our patients. And that connectiveness is the reason why they take their medication, the reason why they call us and ask questions, the reason why they come into our pharmacy, and then they become healthier when you're able to bridge that culture gap. But culture is very important.
Yeah. Isn't that something that should be happening in all pharmacies?
In all pharmacies, in all doctors' offices, in all dentists' offices. But again, it's just, you have to be very intentional. Like the Black Business Expo, you have to say Black Business Expo. You have to be very intentional in the things that you design so that all people have access to these opportunities.
Now, part of that intention is where the pharmacy is located. It is in the Delmar Divide, which houses a number of organizations and your business. Now, I assume you wanted your pharmacy there for reasons that are bigger than profit than green. Tell us, how does the location of GreaterHealth reflect what your business goals are?
Yeah, I think it's what you all talked about earlier about the Delmar Divide. I think historically there has been a divide in the resources on either side of Delmar, specifically north of Delmar, a lack of resources in that community. And so partnering with Maxine Clark and the Delmar Divine and putting a pharmacy there was a lack. I think before we opened, we actually did some market research and we went and talked to over 100 community members. I know the Delmar Divine team also talked to a lot of community members, and what the response was that there was a lack of health resources. There were some there, but there, in other communities, there's way more resources that people can walk to, get resources from, and so the community wanted it. And so, specifically those community members who were north of Delmar. And so the significance of it is just that we're here to kind of help bridge that gap. And so again, us being culturally responsive and radically inclusive, we want to make sure that all people north or south of Delmar get the resources that they deserve. Now, even before the Delmar Divine, before that building was the Delmar Divine, it was St. Luke's Hospital or Regional's Hospital. Another significance about that is that hospital used to be a workforce engine for African Americans in the community, whether they were working in the hospital, being trained as nurses and things like that. So it also brings back that spirit of, Blacks working in healthcare and serving their own community. So it's very significant. Yeah. It's a lot of historical context to being here.
So then as far as the clientele that you will be serving because of geography, those you're hoping to bring to the pharmacy, that's also reflected, I assume, in those who are behind the counter?
Absolutely. And I think that's part of the question you asked earlier, was part of being culturally responsive is for the people who live in the community to come in and see somebody who looks like them.
Absolutely. We feel so proud. I was there for the grand opening, for the ribbon cutting. We were all standing there in tears to see the young men and women walking around in their white lab coats. It was nothing short of amazing. It was a beautiful day.
And we truly appreciate Lisa for, supporting us from the very beginning. Because that early support is very important when you're starting up Black businesses. And so we definitely appreciate you for coming to the grand opening and supporting us. And shout out to our staff, right? So Dr. Kenneth Powell is our pharmacist who has a background in food science, who leads our operation. And also Mary Nungo, who's from Kenya, who's originally from Kenya, who's recently moved over here. And again, it's that culture, it's that different having a staff of different culture and diversity, and being able to provide that to our community.
Yeah. We're going to take a very quick break here, but we'll continue this conversation when we come back. This is St. Louis on the Air on St. Louis Public Radio. Let's return to our conversation with Lisa Potts, Vice President of Delmar Main Street, and Marcus Howard, founder of GreaterHealth Pharmacy and Wellness. Delmar Main Street's Black Business Expo is Saturday, August 26th at the intersection of Delmar and Hamilton. The family-friendly event goes from 11 a.m. to 4 p.m. And Marcus, your GreaterHealth Pharmacy and Wellness is part of this. Now, culturally responsive and culturally competent, those are terms that have been around for a long time, used by healthcare providers and educators, other human services professionals, and you've been talking about it. But how does this show up in the today. Can you share like an example or an anecdote that really illustrates that?
Yeah, no, absolutely. I think culturally responsive, for example, we have culturally responsive products and we have culturally responsive services. And so, for example, as Lisa talked about, some of the demographic of our community north of Delmar is African American. And as they come in, they're able to see themselves as they come in. So we sell things like our tone skin Band-Aids. So basically, they're Band-Aids that match the skin color of the people who actually are patients of ours. And so when they come in and they see, and they've never seen these types of products before, right? And so when they see these products, it's a hey, they care about us. They understand us. This is actually for us. And so that's what we hear a lot. When people see those types of products, it makes people feel like it's for them. We have paintings on the walls that are from Black high school students who donated that to us. Again, Black art in the space of healing and health is very important. So when our patients come in and they see the Black art on the wall, that's responsive to the culture of them. Also, on our bottles. And so we're able to put nicknames and things like that on the bottles. And again, to be responsive of the names that people decide that they want to be called. And so they're just different, and so we train our staff to be able to respond to that. We have profiles, electronic profiles that we take all the information of these people, of our patients, and we make sure that our staff knows the patients very intimately. So when they do come in, we know their favorite thing to cook. We know, we know things about their family. We know things about where they went to school, what they like to do. And a lot of our patients come in and they talk about way more things than the medication. And so I know our staff is laughing right now because, once you build the trust with our community, they will come in talking about anything and everything. Right. But that's what culture responsive is. And that's what you have to understand. You have to understand the culture of the people.
And I think what you had mentioned about nicknames, so just to clarify, what you mean is that the names that are on the bottles are not the government names. They're the names that people go by?
Absolutely. They have the option to do that. And so, again, it means something different from different demographics. You might have people who have a legal name but want their nickname. You might have people who identify as trans who want the name that they're transitioning to in addition to their legal name on the bottle. So there are different things, again, that you want to be responsive to the people. And again, since we're radically inclusive, we make sure that that's something that as a healthcare provider, they're able to do. Like, we don't take sides of anything. We serve human beings, and that's kind of the stance that we take.
And then when it comes to conversations or advice that is given from pharmacist to the patient they're serving, is there something maybe about the way, like a drug that's being prescribed is being, like, this is how you take it, this is when you take it?
Yeah, so one of the things, again, to your point about being culturally responsive, is being able to educate our patients on the medications that they're taking. And so so one of the services that a lot of the community likes and they ask for is the opportunity to sit down with a pharmacist who looks like them, who sounds like them, who understands them, and be able to ask those questions. How do I take that medication? If I'm having side effects, how do I respond to that? Am I able to substitute this medication? Am I able to take a lower dose? How long do I have to take this medication? If this is high blood pressure, are there things, is there a plan for me to take this for a certain amount of time, change my diet, and then not have to take it anymore? And so those are the types of conversations. And again, it all comes down to culture because, again, culture is diet. Culture is the trust that people have in medicine. And so our pharmacists have to understand the distrust historically in certain communities, and then work with those patients in building that trust and having them take their medication, communicating about some of the health concerns, and ultimately becoming healthier.
Now, Marcus, who or what is it that has informed how you understand what a pharmacy is? Because what you're describing is not what I experience when I go to Walgreens or
Exactly.
CVS, right? So what a pharmacy can and maybe should be, where has that come from for you?
I think it come from growing up in the community. So I'm from St. Louis. I think I'm from North St. Louis. I grew up on West Florissant by O'Fallon Park. I went to St. Louis Public Schools, and I think really it's my life experiences. We have family members who struggle, who have historically and currently struggled with health conditions. And one of the common things is a distrust in pharmacy and taking medication. And so I've been in spaces where you hear all of these things. I don't want to take that, or they just getting money and they just making money off of us and things like that. And so you hear the distrust that nobody really trusts that a CVS or a Walgreens actually cares about me and wants to get me healthier. They just want to give me medication. Like you said, I don't think anybody's had experience where you feel like that. So it's kind of like, hey, historically is, hey, you go to a CVS and a Walgreens, you go stand in line for a long time, get your medication, and then you leave,
Yeah.
right? That's the experience that our community cannot afford to have. And so since that has been the experience, that is one of the reasons why health disparities and equities continue to exist. So we have to do something different. And this pharmacy is doing things differently, where it's high touch. It's high touch and really building relationships and really focused on getting people healthier.
Yeah.
That's the goal. Our goal is to make sure that all people experience greater health and a greater quality of life.
And your professional background, it didn't start in medicine or pharmacy. How did you get to where you are now?
No, good question. I've always wanted to go into medicine, but when I went to college, I decided to go into education. So I'm actually an educator turned entrepreneur. Education was one of those things that I realized education is able to transform the lives of people furthest away from opportunity. I grew up in St. Louis, North St. Louis. Education transformed my life and my ability to do things that I never thought was possible. And when you're in education, you start to understand the disparities that exist. Some of those same disparities also exist in healthcare. And so education in healthcare is some of the two biggest things that a community needs to be successful and productive, to build businesses and things like that. And so it was an easy transition, but I've always wanted to go into healthcare, but my first stint in a career was in education, and then I transitioned into healthcare.
Now, this venture, what you are doing, it's new and it's exciting. There are several partners like Missouri Foundation for Health, which has never partnered on a for-profit, and SSM, and they've come in to support and contribute. So there's clearly also some money to be made. How are you going to maintain support in the longer term? That is, like, how do you safeguard against disinvestment, which has happened with so many other things? And how will you keep partners that is accountable to community members?
That's a really good question. Right? That's a really good question because, in the beginning, it sounds good. It sounds interesting. It sounds exciting, right? You're the new exciting thing. It's radically inclusive, culture responsive. All we want to get behind that. But as when it really comes to our focus is helping our community. And sometimes, it takes longer to make money back. It takes longer. Investments don't look as great as if you're in a technology-based company. You're not 10Xing in 2 years. And so it's a very good question. But I think on the front end, it's very important to get people who believe in that vision on the front end, right? And then they'll stay. Like the Missouri Foundation for Health is an organization that focuses on health equity. And so they're going to be with me for the long term because they believed in that mission and vision in the beginning. SSM, very similarly, they're looking to invest in these communities and they're looking for an opportunity to support those furthest away from opportunity. And so when you get those people in the circle who initially on the front end believe in it, those are the people who are going to stay long term. And so if I would have did the reverse, I would have got people who were just looking for money or on the front end. Those people eventually will leave, but you got to find mission-driven organizations, mission-driven people who really want to see, impact and an improvement of health in the St. Louis community. And I think when you do that, you're able to keep the people long term.
Yeah. Lisa, you've been nodding throughout.
Yeah.
What is it that he's saying that reflects what your goals have been with Delmar Main Street, and in particular with this Black Business Exposition?
Absolutely. No, that was a great segue. Yeah, Marcus, I was nodding on everything Marcus was saying. I've been in there and I've got the black Band-Aids. I've been in there because something bit me one day and my hand was swollen up, and I don't think you were there that day, but the other guy took care of me. But they're personal. Like, they called me, the nurse called me the next day to ask me how I was doing. I had to look at the phone. I was like, "Oh, you just calling me back?" She said, "Yeah, I'm just checking on you. Make sure you're taking your medication." I was like, "I'm gonna lock you up my phone in case I need to call you back for something, because I don't do medicine." But what Mark is saying is spot on, because it's about community. Like, we have embraced that pharmacy. Every time I tell somebody there's a black pharmacy in the neighborhood, I get a look like, where? I didn't know. When was somebody gonna tell me? And it's like, it's about exposure, which is why I wanted Marcus to be at the Black Expo, because I want him to get that exposure. I want everybody to know, hey, there's a pharmacy over there that can take care of you and will transfer your prescriptions for free.
Lisa Potts is Vice President of Delmar Main Street, and Marcus Howard is founder of GreaterHealth Pharmacy and Wellness. Marcus, Lisa, thank you for joining us.
Thank you.
This episode was produced by Maya Norfleet.
Our audio engineer is Aaron Dorr. This podcast was mixed and edited by Aaron.
Our executive producer is Alex Hoyer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
St. Louis on the Air proudly supports local artists by using music from Life Creative Group.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations, and leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thank you.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.